Mine's not a question, it's a suggestion.
Great.
Your town hall meetings on the phone, you said you're gonna put out the dates and times and everything. My suggestion would be that you put it in the local newspapers, maybe for Ajax and Scarborough.
Yes.
And maybe even a billboard, like the rental billboards that you can put the letters on outside of both sites, for the community to be able to see the billboard and get the number of the call in or whatever, so the community is more engaged in those towns. Like we know the Friends of Ajax are very supportive of the hospital, and they would probably be interested in being on.
Great ideas. I hadn't even thought of the billboards. Mary Ferguson is hiding way at the back of the room behind the TV, and she's actually the communication lead. She's housed at the Central East Lynn because she's supporting both of the hospitals. So I saw her writing down what you were saying, and she's come here to listen to our suggestions. So she's helping to organize those town halls. Yes, Samantha?
So, in terms of the working groups currently, are our community partners involved in these working groups? So, representatives from the Central East Lynn, CCAC, those that provide services out in the community, like the nursing visiting agencies and so on?
Right, that's a really good question. So the answer is yes, they're involved in the working group process, but not in the meetings. And remember, I made that distinction. The meetings have about sort of 15 to 25 people on them, but that's just the starting point. They're getting the workbooks drafted, but then we're publicizing them so that everybody can read them. So definitely all of those partners you mentioned have access to what the working groups have drafted and can have input. And I know some of the groups are actively going out and talking to those folks and getting their feedback. I'm part of a group that's gone out and talked to folks at Sick Kids, at Mount Sinai, to make sure that we touch base with our partners. And I think all of the other groups are doing that as well. We can email it directly to those folks as well. John?
But there's also the facilitated community engagement sessions.
Yes,
that we're
great.
going to do, right?
Yeah, good reminder. So those 16 roundtables that I mentioned, a few of them include the CCAC and our other partners. Ajax, any questions?
Any questions? No questions here.
Okay, so maybe I can ask a question then. One of the questions that we'd like to get feedback on, and this is something that when we come around and we do your team meetings and your huddles, we'll be asking this question again too. But if a decision was taken to merge the two hospital corporations, what concerns or what questions would you have? What's top of mind? What do you need to see or hear? And sorry, I threw that out to 100 people, so I know that's dangerous. Can someone put up their hand to speak first? Loud voice.
Losing the job.
Losing job. So what do you need to see or hear about that? Pardon me?
What are the chances of the people losing jobs?
Right.
And you taking care of the people not losing jobs?
Okay. So you'd want to see some clear human resource planning around what is the plan for the various departments and where there might be downsizing of jobs and what the strategies are, right, to support people. Okay. That's a very fair comment. Selena?
And when we start to begin to see those changes, when those changes would be implemented, if they were implemented.
Yeah, so clear timelines around those changes. At the back, please, and then I'm going to go to Ajax.
I'd be a little concerned about what programs are being cited. I have a very long travel time, and I really don't want to use it.
Okay, so from a staff perspective, would you be asked to go to a different site than where you are now? Okay, yeah. Teresa, did you have a comment?
Just if services would be impacted, like what services might be eliminated, what services might be created.
Yeah, so what's going to be the impact on services? And so, of course, some of these things aren't going to be known on day one, right? We will have to figure this out because one of the things that would have to happen if you merge is that a new board would have to be created. They'd have to decide who they want to hire to be the CEO and the chief of staff. So these things will come in time. But these are all really, really key questions that we need to make sure that we're clear about. So even if we don't know the answer, we at least tell you the status and how we're addressing it. At Ajax, what are some of your questions or concerns that you want to make sure we're thinking about?
types of concerns over.
Job security, that kind of thing.
Job security? Okay.
Yeah, comments, Michelle,
Similar? Okay.
with what was said there.
Right, and I think in addition to that, what I heard earlier was just concern about the Ajax site as a whole and how that fits into the broader picture. Yes.
And how the patients would be affected in the long run, like the quality of service and quality of care.
Yeah, how are patients going to be affected? Yes.
It seemed like one of the major impetuses for this whole process was Scarborough Hospital attempting to put some things at one site and some things at another site.
Right.
How is it going to be different if all 4 sites are?
Yeah, that's a really great question. I like the way that you phrase that.
Can
I'll
you-
repeat it, yeah.
yeah.
So the question was, when you think back, that one of the things that actually sort of started all of this was the Scarborough Hospital had done a strategic plan document, a strategic plan refresh, and part of their plan was to change where certain programs were cited. You might remember. So they had talked about, you know, maybe not doing obstetrics at the general site, doing it all at Birchmount and that sort of thing. So the question was, what's going to be different this time? Because that didn't go over well with certain stakeholder groups. So as we get into questions about siting and where things will be, how can we assure people that we're not going to go down that same road? One of the things that we're always cognizant of as we're having these discussions is learning from the past. And I know that my colleagues at the Scarborough Hospital don't want to repeat that because there was a lot of anxiety and a lot of disagreement from stakeholders about some of the decisions that they were making. In the end, they had to bring in an expert panel to give some recommendations about what they were recommending, and the expert panel had some concerns about some of those changes. So that's why we've stopped, and we're now following a different approach. So I think one thing is just learning from history, and the other thing is making sure that stakeholders are engaged right at the beginning, and that everyone has a chance to have input into any of the ideas and the recommendations that are being considered. And that there's transparency about that, and that there's buy-in, so that you can have all of the debates as you're working through it, as opposed to after the decision has been taken. Would anyone like to add anything to that? Okay. All right, I'll take a different question then. Samantha?
Just a question about, we've spent a lot of time, effort, and put in a lot of man hours to develop the new bed mapping for Rouge Valley. And I'm wondering, with a potential amalgamation between now 4 sites, I know we've been given direction to continue with our bed mapping, but how is that going to impact with potential amalgamation of services? What's bed map going to look like?
Are we going to need a different bed map?
Yeah.
Good question. Sure.
I did it just for you, Cheryl. All that hard work on the bed map.
Thank you, Sam. The bed map will absolutely continue. And that, in fact, it's one of the things that we think is most critical. And we think that it is one of the, that some of the innovations that you guys have all planned with us to put into that bed map are the things that are actually going to lead Rouge to be a stronger leader in the future and as we go forward. And we have opportunities to help spread some of that potentially to the Scarborough Hospital if indeed there is further integration there. But the changes that we're making with the bed map are absolutely critical to improve quality and safety for patients and families, and that's why we're doing it. And we need to continue to do that regardless, and whether or not we're merged with the Scarborough Hospital, it doesn't make a difference, that those changes are critical either way. So the bed map remains a very important priority, as does collaborative care. Right? Collaborative care is all about shared decision-making, shared understanding, and shared care planning for what our patients need. Those 2 things are critical for future success.
Thank you, Cheryl. Is that, yes, a question at the back. Yes, loud voice.
Investigating the barriers to the collective agreements when you're doing your focus groups between 2 sites.
Excellent question. And we have a human resources group,
Question?
Kathy. Oh, sorry, let me repeat it. Yeah, are we looking at the collective agreements and the stipulations in there? Because the collective agreements do have some language around how integrations and mergers should be handled, and we need to respect that. So I'm going to ask Kathy Gooding to speak to that. She's part of the Human Resources Task Group.
So we have very specific legislation and also collective agreement language around integrations and mergers. And so when a decision is made regarding which way we're going to go, absolutely we'll be following that language. There are opportunities, we think, in terms of language, local language and that kind of thing, because there are differences between the two organizations, and the HR group is in fact looking at that now. So, and we'll be doing this in the... Sorry, Andrea? Yep, we're coming up to bargaining. Yeah, there's lots of opportunity. Yeah, absolutely. Yeah.
Kathy. Anything else from the Ajax site? Yeah, I see a hand at the back.
One of my concerns is for the community of Ajax. We're having trouble even keeping up with services now to service the public that we have to service. And I'm finding, like, admitting is going over to Centenary. We keep losing pieces to different, and I'm afraid with this merger, we're going to get swallowed, and this community will not be serviced properly.
Well, the commitment that's been made is, and I can't speak to the admitting move specifically, but we have made a commitment that we're not going to be touching the patient care services at the Ajax site. So those services will remain, and I think we have to recognize too some of the new services that have come to Ajax in terms of, you know, expansion of complex continuing care and expansion of the Emerge and a number of other things. So we have been trying to recognize the growth in Durham, which is much larger than the growth in Scarborough, and we know that you know, that's something that we're going to have to be cognizant of as we go forward. Yeah. Sorry. Question at the back. Do you want to?
I'm a little bit concerned about your comment about buy-in. Based on the attendance at the town hall, I don't see any front line. So I don't think we want to go into an integration merger with the front line kicking and screaming and not really truly knowing what's happening. I know they can go on the internet and look at the workbooks, but I think they need some face-to-face so that they are on top of things as well. They don't get the opportunity to attend these due to the commitment of work.
Yeah.
So, I mean, if collaborative care is going to be truly collaborative, and now we have to work with our peers at 2 other sites, I really think you need to have some frontline buy-in.
Yeah, I agree. What advice would you give us?
I would suggest going to their units and
Yeah, face to face. Yeah.
and not at 10:30 or 11 in the morning when they're exceptionally busy. Try 2:30.
Sorry, what time?
Try 2:30 in the afternoon.
Yeah, late in the afternoon. No, that's good advice. So that was part of our plan, and I appreciate your feedback because we're just in the process of working out the details of how we're going to schedule that. But we realize that town hall is just one way. That would never be the only way that we could engage 7,000 employees. So we are planning to do some face-to-face, as you said, go and speak to small teams in different departments so that people don't have to leave their department. And we have a little bit of experience with this. I know Kathy led a process like this when we did something like 86 different little small groups around the hospitals, weekends and nights, and that did work quite well. So we'll take your advice around the best times to go, and you know, look to you for feedback. Some of you will have a chance to be part of those sessions, and let us know if they're working for you or if there's something that we should be doing instead or doing differently, so that we can readjust.
I just wanted to add to the communication strategy, Michelle. I know that our group has already started communicating with the frontline staff and having meetings with them. So after the first meeting, the workbook's been shared and the staff have been provided the feedback form. And now after the second meeting, I believe that was last night, we'll have another follow-up with them.
Yeah, and I would actually suggest, I'm going to take it back to our patient care task group, that we even make that a requirement, that all of the groups make an effort to go out and get frontline staff input on their workbook. Some are doing it already, and they don't need to be told, but just as a reminder, I think that's so important. Ajax, anything?
Doesn't look like it.
Okay. Any more questions from this group? Yes.
If commitments have been made for new equipment purchases, will that still carry forward?
Oh, good one. Let's get our chief financial officer in on this.
I can tell you 100% with 100%.
Can you repeat the question though, John?
Sorry, yes, of course. The question was, any commitments that we've made with regard to capital or equipment purchases, will they be honored regardless of the merger? The answer is absolutely yes. And in fact, I would suggest to you that as part of the merger and as part of a potential merger, the workbooks, if you look at them, especially after stage 2 and then going on to stage 3, are going to include a number of additional items, because we're going to need to recognize that there's going to be investments required. If you look at mergers, not only in this province but across the country and in North America, usually there's a lot of one-time investments that are made. We're hoping that if it comes to pass that we're going to do a merger, that the ministry is going to help us with some one-time funding. It's not unprecedented. They have done so in the past. They're not in the greatest financial shape right now, so a merger right now with the province being in the state that it's in is not great timing. But certainly, I would fully expect that a recommendation to merge would also include some level of investment in terms of an ask to the ministry. And I would expect that we need to make some investments, not only in equipment, but also in IT. So.
Any other questions? Joe?
Here too. Number 2 of them.
We have one question here, then we'll come back to.
With integration, what would be the role of community agencies like CCAC and other partner agencies?
The question is, with integration, what would be the role of the CCAC and other community agencies? And we're consulting with them as well and getting their thoughts. One of the immediate things that we see is that it would probably make it easier for them to interact with us, because there'll be just one entity that they need to partner with instead of 2 different hospitals. So hopefully that would make it easier, and that if we have common policies and practices and intake processes and so on, it should make it easier for all the family physicians and folks out there to deal with one group rather than 2. But we're also consulting with them to get their thoughts on that. Was there a question on Ajax?
Yeah, we have 2 questions,
2,
so this will be our first one.
Once you start the integration process, is there any going back, or is this just once you integrate, that's it?
If your question is asking if we decide to merge, if there's any going back?
If there's an actual merger, if for some reason it's not working out, is there any way of going back to the way things were, or is this just a one-way?
That's a really good question, and I think that would kind of depend on where we were in the process and exactly what the stumbling block was. That's a difficult one to answer, but I think once the decision has been made in the sense that the ministry has directed the merger, and maybe a new board has been formed, that it would be rather difficult to undo that and start again. We would probably more look at what it would take to make it work once we've made that investment to go ahead. But that's only my opinion, and I'm not really sure. I think it depends on where we are.
Both hospitals are in a pretty good financial situation, or is this a more or less measure to bring costs together?
Both hospitals are struggling, I think, like every hospital in the province, but I'm going to let John elaborate on that one.
Yeah, so, just in terms of the financial situation and financial pressure that both of our hospitals are facing. Certainly, Rouge Valley has come a long way, as you know. We've been generating surpluses for the last several years. I fully expect that if we continue to do what we need to do as an organization, we will continue to be successful. And as Cheryl quite rightly highlighted, BedMac and collaborative care are keys to making us successful, because where Rouge Valley is struggling right now is not so much developing a budget that balances. We're pretty good at doing that. I think the issue right now is we are facing unprecedented pressure in terms of our patient volumes. Complexity obviously is an issue as well. And the costs of providing that care continue to go up in a climate of decreasing funding. So we have to think about doing things differently, more efficiently, utilizing our bed capacity better, utilizing our resources better, And that's what the bed map is all about. So what's ending up happening is we're actually running unfavorable variances, especially this year. If you look at our financials, we certainly started Q1 slow. We're running an unfavorable variance right now. We're starting to recover, which is really good. So we're up to the challenge, and we've shown resilience, and I expect that we're in pretty good financial shape. We have a lot of cash, which is good. We've built up a good cash base, which is allowing us to make the investments that we need to make in capital. So we've got some cushion, but it's not going to last forever, and especially in declining funding, we're gonna have to work very hard to try to stay in the black. Scarborough Hospital, I'm not going to speak in detail on their financials, but the Scarborough Hospital obviously had to make some tough decisions as part of its strategic plan refresh. Part of that thinking was around service delivery, but part of it was a financial imperative that they needed to balance their budget, and that led to some decisions, some of which they implemented, some of which they didn't. Their expectation is to balance again this year, and I fully expect they're going to attempt to balance next year. And as a merged organization, the question becomes, are we stronger or weaker from a financial perspective? I would suggest to you that a decision to merge would factor that into consideration. I mean, that would be a huge consideration in terms of, are we stronger financially? Are we more resilient as two organizations versus one? I can tell you from a funding perspective, size does matter. So in this current climate, if you have organizations that have larger capacity, that have the capacity and the expertise to attract greater volumes of patients, that have the capacity to attract the best resources, the best skills, and the best physicians and clinicians, are going to fare better, especially if they can do well on quality. The higher the volumes of patients in general, the better the quality of care, if the organization is focused on quality. So I think the reduction in competition between two organizations competing for the same funding pie is a good thing. So there is some certainly benefit under the new current funding formula to being bigger. Does that shed some light? Okay, thanks.
Okay, thanks, John.
So actually, that was wrong. We have two people who want to ask questions.
Okay.
Let's do questions.
Mine's more a comment and concern rather than a question. Currently, we in the means of trying to make things more efficient, we're sharing managers and CPLs across sites. Yeah. So I have a concern about if we were to integrate. Now, if we're looking at 4 sites, is there going to be further sharing? And that certainly impacts on the day-to-day running of units and the frontline staff, just trying to get things done and make decisions. And if there's not someone on site, and speaking as the probably smaller of the sites at Ajax, very often we don't have on-site management or CPLs and are constantly calling, blackberrying, et cetera. So it just does make things more difficult, less efficient. And then just speaking as well from my department, the nutrition department, Ajax lost its kitchen and we don't have any ability to make food here. So that also presents a lot of challenges and stresses and not really great patient care in some respects. So again, if we were to integrate, how is that, you say direct patient care services probably won't be affected at Ajax, but what about support services and DI, lab, these other services that are involved? Like, we may not be closing down units per se, but these other services may be shared, and that's a big impact.
Yeah, that's a really good question, because there is that distinction. We recognize that there might be some sharing, as there is now, in terms of the back office, so in terms of finance or IT or even food services or human resources. When we're looking at those areas, there may be opportunities that involve all 4 campuses, including Ajax. But for direct patient care, we've said that there won't be any impact on those. But you're quite right, there could be some changes around the back office functions. So I'll be honest about that. I don't know exactly what they would be, but that's a possibility. And your point about management and whether we're going to have managers at 2 sites or 3 sites or 4 is also a really good concern to raise. It's too early yet for us to talk about what the leadership structure will be and what the span of control will be for certain managers. That's something that will come after November, after a CEO has been identified and that CEO has developed a leadership structure. But one of the things that I would say, as I mentioned earlier, both hospitals are using Lean as a management philosophy. And one of the things we stress in Lean is managers being on site, spending time in the Gemba. So we know that that's an important part of our philosophy, and I don't see us wanting to lose that, even if we merge. So we'll try to design leadership structures with that in mind. I'm just cognizant of the time. I'm just going to just make a few closing remarks. And if people have additional questions, don't hesitate to come to me directly or your manager or any member of the senior team. Because we really, really appreciate your input. And we know that you have all taken time out of your busy schedules just to come to this town hall. And we really appreciate that. We like the challenging questions. So Cindy and Carol, I think, just left, and Andrea and Leanne, folks that have a responsibility for representing the frontline staff, keep bringing those tough questions and keep bringing those suggestions to us. That's part of your role, and we really appreciate that because we need to make sure that we're keeping the important things in mind as we go through this. So really appreciate any and all questions and comments. So as I said, this is just the beginning. This is just one little 1 hour town hall just to bring everyone up to speed and to do some questions and answers, but there's a lot more to come. So go to that website, take a look at what's there, look at some of the workbooks, but also be on the lookout for when we come around, because that point about the face-to-face and going to the units is a really good one, and we're committed to doing that. So we are going to be coming out to the departments, and we're going to be following up on the question that I asked earlier about what are your concerns or questions about the merger. But in addition, we're also going to be asking you, what are your ideas? Where do you see some opportunities or benefits? Because you're all working in your jobs, you're the experts and you have a lot of input to share as well. So through those sort of road shows, we'll be asked that question. So start thinking of those ideas. And again, just thank you so much for taking the time out and for your honest inputs, and we will definitely take it all into account. This is being videotaped. You'll have your colleagues that weren't here will have a chance to see you on the video. And we'll be scheduling another town hall in another couple of weeks. Okay? Thanks very much for your time. Appreciate it.